Hi everyone, I am overwhelmed with your warm wishes and I shall today discuss about the kidney and its blood supply clinical anatomy. Now all of you know that the kidney, that is the bilateral structure situated in the posterior abdominal wall. You see, this is the posterior abdominal wall. And this two kidney lies below the diaphragm, so it moves about 1 inch during the respiration, and this is the very essential organ of excretion of the waste product from our body. Now the waste product is formed by the metabolism of the different things, the drugs metabolism in the liver, and all these are excreted through this urine, through the ureter up to the urinary bladder, you see, and timely it is evacuated when the urinary bladder is full of about 220 to 250 cc of urine. Now such a organ, that is a valuable organ that lies within the costal margin and it is protected by the costal margin. The two kidneys, the right kidney is at lower level than the left one. The kidneys had got two poles, the upper pole and the lower pole. The upper pole is more rounded than the lower pole. It has got two borders, the lateral border is the convex border and the medial border, you see, it is concave and it is indented by portion which is known as the hilum of the kidney. So you will see that the two borders, the lateral border, the medial border, two poles and two surfaces. The anterior surface is more convex and the posterior surface, it is convex but a less bit than the anterior surface. So it presents the rule of two poles, two borders, two surfaces. Now, what are the coverings of the kidney? This is very important to make the kidney in the position, because in the abdomen there are so many of organs are situated, so there may be some risks of dropping down of the kidney. So what are the structure that prevent it from dropping? So from outside, from inside outwards, you will see the first there is the renal capsule. It is a bit white color, though the kidney is, that is the reddish brown in color. You see, I have shown you this kidney. This is the reddish brown in color. You see the looks of the kidney, the reddish brown. Now this kidney, you see, it is covered by the capsule, and this capsule you can easily strip off the capsule. Next, outside the capsule there lies a pad of fat encircle the kidney, and that is known as the perinephric fat, and this perinephric fat goes into a cavity which is known as the renal sinus. Inside it goes into the renal sinus. So after that, that means this renal perinephric fat, you will get the renal fascia, which is formed by the which continuity, and that fascia laterally blends with the fascia transversalis, and also in the upward it blends with the diaphragm. Below it blends with the fascia iliaca. Next you will see in the outside portion, particularly near the lower pole, there is accumulation of severe fat that is known as the perinephric fat. If you visualize any shop, that is the meat shop, you will see if the whole goat is suspended for the delivering the mutton, then you will see the kidney region, there is white fat, very much fat is there. Similarly, the same thing you will get if you see the MRI view of the abdomen. In the kidney region, the white region, because of the accumulation of the fat. And this fat is very important when in severe weakening of the body due to cancer, when this fat is go away from the kidney, then there is dropping of the kidney into the pelvic cavity or in the right or left iliac fossa. So this is the coverings of the kidney. Now what are the structure related to the anterior surface of both kidney? In the anterior surface, you will see in the upper part, on the both sides, the suprarenal gland is located. The right suprarenal gland is triangular in shape and the left is semilunar in shape. And this anterior surface near the hilum, there is a concave area which is non-peritoneal, that is related with the duodenum of the, that is the first part of the small intestine. Now most of the upper part in the lateral aspect, it is covered by the liver. In the lower part, it is related laterally with the right colic flexure and medially with the coils of the small intestine, particularly the jejunum. So this is the right-sided relation. The left-sided relation is different, because in the left side you will see this is the cut area of the stomach. The stomach is related to the left kidney. So upper part below the impression of the hilum, there is the relation of the stomach. Then in the middle there is the crossing of the tail of the pancreas, and below it is related with the left colic flexure and medially it is related with the jejunum. So this is the anterior relation of the kidney. Now if you look the kidney, you will see behind it is related with two important muscles. You see the lower part is related with the psoas major muscle, and this is the quadratus lumborum. And in the upper part it is related with the diaphragm. In the both kidney, it is the same thing is related. And you will get three nerves, that is the subcostal nerve, the iliohypogastric nerve and the ilioinguinal nerve. The iliohypogastric and ilioinguinal, that is the branches of the lumbar plexus. So this finishes the relations of the kidney. Now if one do the coronal section of the kidney, what you will see? You will see the coronal section of the kidney, there is magnification of this coronal section. So you will see here in this coronal section, the outer portion is known as the renal substance, and this cavity portion is known as the renal sinus. Now this renal substance is again subdivided into two parts. The outermost part is known as the renal cortex, and the innermost pyramid-like, about 16 pyramid to 20 pyramid lies, it is known as the renal medulla. In between the two medulla there is extension of the cortex, that is known as the renal column. So what are the things you will see in the cortex? You will get mainly the glomerular tuft of capillary, and you will see the Bowman's capsule. Most of this cortex is filled up with that. And you will see these are nothing, the Bowman's capsule is nothing but the part of the nephron. Now what is nephron? Nephron is very tubular small unit. If you see actually the cotton thread, so the cotton thread bunch, the kidney is like that. If you pull the cotton thread, it is long and long and long. In the home cotton thread, you will get the length is about 100 meters to 150 meters. But if you imagine this nephron, if you tie together, it will go up to 170 kilometers long. So one can reach from here up to Durgapur by this joining the nephron. So you will see this is the cortex, and this junction of the cortex near the medulla, this is known as the Jagstra medullary cortex. And here there is very few amount of that means the glomerular tissue is present, that means the Bowman capsule with that is the Malpighian corpuscle is present here. So most of the time the function urine formation takes place through the cortex. But when there is in cortex is damage or by other means it is some disease, then only the juxtaglomerular cortex takes the upper hand. But if urine is produced by this juxtaglomerular cortex, the urine is very scanty in amount, and that condition is known as oliguria. Next thing, you will see the pyramid. Pyramid, it looks like the rays, so it is known as the medullary rays. Because all the tubules, that means the loop of Henle's, the ascending limb, descending limb, the convoluted tubules, or the tubules forms this medulla. And in this medulla, there is counter current mechanism by which the urine formation takes place. We evacuate 1.5 liters of urine per day, but we actually produce 15 liters of urine per day. So that is absorbed by this medullary rays. So this is the interior. Next you will see, if you trace the pelvis of the ureter, you will see it divides into 2-3 large divisions. They are known as the calyces major. This major calyces again subdivided into small part which is known as the minor calyces, and this minor calyce is receiving the apex of the renal pyramid, where you will get about 16 to 20 duct of Bellini through which urine is accumulated within the pelvis. The capacity of the pelvis is about 7 cc, and then this urine is going downwards and downwards. And do you know the urine which goes into the urinary bladder, that is not drop by drop, it goes into it by jet. Next thing you will see here, within the capsule, within the renal sinus, you will see not only the ureter, there are blood vessels, the renal artery, the renal vein are all there. The relation is from before backwards, vein, artery and the ureter, because this is the posterior aspect, not the anterior aspect. You also tell that what is the vow of this thing. So vein, artery and the ureter. Next thing you see, this artery, how you will see the renal artery, this is the cast of the renal artery within the body, and this cast you will see there are right renal artery which is longer than the left one, because the abdominal aorta is situated on the left side, that's why. And this renal artery divides into number of lobular artery, and there are about 5 sets of artery, lobular artery you will see. One goes to the anterior surface, one goes to the posterior surface, and the other 4 goes on the anterior surface. One is apical, then anterior, then lower. So you will see this type of arrangement, and this finer branch, it gives rise to arciform artery, and from there and the vertical branches arises that gives light to the glomerular tuft. This is the capillary system. You will notice in this ureter this thing. So it is like a strainer which strains blood, and which of the thing, the impurities present in the blood, and which is the natural phenomenon by our higher power to eliminate all these bad things through the urine. And what is the clinical anatomy of this kidney? You see that there are congenital anomaly, there are acquired anomaly. In the congenital anomaly, there may be development defect. The two parts of the developing urinary tubule do not unite. So there is the urine formation occurs within the kidney. If it is affected very much, that is known, give rise to polycystic kidney, and the patient will live not more than 20 years. Next is, you will get also the kidney disease. There are glomerular nephritis. All this kidney, that means by means of the infection, the kidney tissue is inflamed. Inflamed means that not normal. So if this is not normal, anything cannot perform the normal function. So there is impaired of the formation of the urine. There is also injury to the kidney, severe blow from behind. There is bleeding within the kidney. So many of diseases are accompanied with the kidney. Not only that, the diabetic mellitus disturbs the vascularity of the kidney. How? The basement membrane is thickened and there is less formation of the kidney function, the less formation of the kidney, accumulation of creatinine and the other waste product. So in the severe cases of diabetes, it requires the dialysis. So thank you everyone. Thank you everyone for watching this video, and also subscribe my channel.